Today, we welcome back Dr. Cory Goldberg, who is a plastic surgeon in Toronto. He is so amazing, and we had such an awesome conversation about him. I really love speaking to him because his approach to the skin is not just the skin itself, it's like the overall health of your skin, the overall health of your body, and how you take care of it day to day with like the simplest things. In the beginning of this episode, we spoke about a conference that he went to, and it was his takeaways were just like, you need to move your body, you need to eat well, you need to sleep. It's like the simplest stuff to really have the best outcome of your skin. But we did really dive into also longevity and different ways you can take care of your skin throughout your lifetime for optimal skin health.
Well, Tashi, that was one of the best intros I've heard you do. I don't need to say
I just
anything
like
else. You covered it all. It was awesome.
I know, right? No, but honestly, it's because he's just so great to talk to, and you always
Yes.
learn so much with him. And like I'm repeating myself, but his approach is just so simple. Like it doesn't need to be that complicated, and it's just like basic human, like I don't know, is it the word habits or just like basic human things that we should be doing and taking care of ourselves that leads to
Hmm.
health, overall health of the skin. But I
Yeah,
mean,
and
yeah,
he
we did
lives and
we
breathes it too, right? He lives and breathes it.
yeah.
He preaches, he practices for himself personally. We've had conversations with him in the past about eating a plant-based diet, and so he lives and breathes what he
Preaches.
yeah, in his practice. And you're right, he's got a beautiful personality, very approachable, very knowledgeable, very informed and curious. So it's always a fun time talking to him. So yeah. And with
Yeah,
the
so
conversation around that like this big huge, I don't want to say trend because I don't like that word, but this big, huge movement that we're seeing everywhere right now on longevity. This was just the perfect podcast episode to feature at the start of the year so that we can really tap into that and educate ourselves a little bit more on that. So, welcome to the podcast, Dr. Goldberg.
Dr. Goldberg, we're so excited to have you back today. This is, I believe, if I'm not mistaken, maybe our third or fourth time having you on the podcast, and we're just so excited to dive into today's conversation. There's a lot of things today that personally I really want to learn more about, and I'm sure our listeners as well. But you did mention off air that you just got back from a trip in California for a longevity conference. And since it's such a like hot topic right now, longevity, I really want to know, what is longevity to you, and how do you implement day-to-day practices to enhance longevity and to really like get it going?
Well, first off, Natasha, it's a pleasure to see you again, and Beata, a pleasure to see you. You guys
You
are
as well.
lovely. I've always enjoyed our conversations, and I think you're
Yeah.
right. I think this is our fourth time speaking. My experience down in California, I was in just north of San Francisco at a place called the Buck Institute, which is globally the one of the centers, if not the epicenter of anti-aging research. And there was a roundtable of longevity clinics there for a couple of days that I attended. I went last year as well, and I mean, really an amazing group of people, and really, research, both clinical and basic science, really advancing in the space. And the longevity clinics that were represented there, the data they presented, and what they're doing with their patients, really, really amazing and inspirational. I mean, I think that evolution in healthcare is coming, and it's here. So I really enjoyed the conference. Some of my take homes, I would say, most importantly, and I always hammer on this because it's easy to forget it. The most important things you can do for your own healthy longevity are related to your general behaviors, and those behaviors very simply are good exercise every day, healthy diet, which we've talked about,
Yes.
sleep, a good amount of sleep, and emotional and psychosocial wellness, which includes connectivity and social interaction. If you can get 20 minutes of good exercise every day, eat healthy, and try and stick to things that grow from the ground as much as you can, sleep a healthy amount every night, make sure you're well rested, and love more and spend more time with people that you care about. If you do
Community,
those
right?
four things, community, that's it. It's not rocket science. It's just a question of really adjusting your behavior to try and maximize your own health. And there's lots of supplements and things on top of that we can get into. But I really like to hammer home the message that the most important thing that people can do is really just about their own personal behavior and their social interactions.
100%. I was just reading an article at the Mayo Clinic about blue zones in the world, and one of the big things was that social connection with people is a big part
Yeah,
of life and
absolutely.
longevity. You know.
Some of the data around the blue zones, some of it has been called into question, and undoubtedly, it's a question of reported birth dates and some records that were potentially falsified. It doesn't really take away from the message. There's no
Yeah.
doubt that those people are living much longer than the average person in North America. So you dilute the waters, and take away from the message if you look at that. I focus on the fact that people in those blue zones, including Blue Zone 2.0 in Singapore, those places, they have very specific, I mean, their diets differ, but they're all roughly, they're all basically healthy. They're very plant forward. They don't have a lot of animal proteins in it. They all get good rest. They all socially interact. Their families are all close knit and stay
Yeah.
together. Those very basic things, I mean, that's helping people to live longer. Those people are not taking special supplements or getting intravenous therapies. So, there's no doubt in my mind that the most important part of healthy living is lifestyle. And one of the speakers that I saw at the Buck Institute in San Francisco, I mean, a real icon in this space, Dr. Dean Ornish. And Dean Ornish is known as the lifestyle physician because he's done the studies looking at how lifestyle affects specific health measures. So, one of his first ones, a really fascinating heart lifestyle study, in which he showed that just the very basic healthier diet, vegetarian diet, modest exercise every day, stress counseling and support groups, bringing people together, that alone was able to cure heart disease in a vast majority of patients. It improved their cardiac blood flow. I mean, the impact on these patients was far beyond what any drug could possibly have done for them. Some of these
Hmm.
patients were patients who were about to, require a heart transplant because they were so unhealthy. And that was just one of many studies that he's done over the years. So, he's the person who really has exemplified and brought forward the recognition that this is not pseudoscience or hand waving. Lifestyle is undoubtedly the most important medicine that you can take to improve your health.
Yeah. There's a lot more in our control than we realize. I think is also important to understand. And I just wanted to ask you. You talked about sleep, like getting a good, healthy amount of sleep every single day. What would you consider to be healthy amounts of sleep?
Well, yeah, you've hit me on a bit of a sore point because I got to be honest with you. My sleep, I'm not sure how healthy it is, and I have some thoughts around that. But generally speaking, the recommendation is 7 to 8 hours of sleep a night. And I am not a sleep expert by any means, so I'm not gonna differ from that. But one thing I would note is that the requirement for sleep, it varies in my opinion, and I think that this varies partially from genetics, and also partially from your own lifestyle and health choices. I think that there are certain drivers that require you to have more sleep, and there are therefore things that you can do that might require less. So, my average night of sleep is about 5 hours. So it's
Hmm.
definitely less than the recommended. So I don't recommend that to people. I've been doing that for a very long time, and I sort of have my own regimen around that. But healthy sleep is generally considered 7 to 8 hours a night.
Hmm. Hmm. Yeah. Yeah.
Yeah, I would love that.
I'll follow up with you.
Same.
One of the things that you mentioned there, Beata, which I think is really important for listeners, is this sort of relationship between what is in your control and what isn't in your control. And the sort of older twin studies that looked at sort of what is nature nurture, what is
Hmm.
genetics and nature versus nurture in your environment. It was generally considered that about 80% of your outcome was your environment, was your behavior. And I'm using past tense because, in fact, more recently, data has shown that it's even less than that. So it's actually about 7% of your sort of dictated health is related to your genetics, and 93% is based on your environment and your behavior. And that's sort
That's
of the most
interesting.
recent data. So that's, how many people who point and say, well, my mom had this, my mom was overweight, my mom had heart disease, my dad was that. It's all about my genetics. I'm a prisoner. I'm a victim of my own genetics and my body. And I really want people to break out of that jail. Because if you're
Yeah, we also
stuck in
set
that mindset,
intentions on stuff. Like you're setting an intention on yourself. You're superimposing an intention on yourself when you think a certain
yep,
way, right? It's
absolutely. I mean, as soon as you set that intention and your intention is, I can't do anything, I'm at the mercy of my genetics, I'm a victim, that's it. You put yourself in that box. Your intention is not to change, because what's the point? 93% of your health is in your hands. You can control it. And it's only 7% that you've been handed. And, that 7% does make a difference, but 93%, I mean, that's an overwhelming majority. And that we can change. And we can change it with just a little bit
absolutely,
of effort.
yeah. And how we
Okay,
think about ourselves,
I wanted
Tash.
to ask this question because like I when you answered like what is longevity and like how what are your takeaways from this conference, of course there's a part of me that was expecting like this really big answer, but it's just so simple, like exercise, sleep, healthy diet, and connecting with people. Why is it so difficult for our population to do that? Like why is it now that this is such a hot topic? Because we should naturally, it's such basic things to be getting good sleep, to be eating well, to be all these things, but us as a society, we're not, I guess, not doing that so well at these conferences are happening and we're trying to like improve it. So like, where are we like, let's say, I don't want to use the word failing, but like, where are we not, like, where are we failing
Where are
at
we
with this whole
Yeah,
challenged?
thing?
Where are we
we're
challenged?
we're child. I think it's fair to say that we're failing. I mean, up until now, if you think about the last 100 years of the human species, 100 years ago, the world was a different place. Families lived together. There was no such thing as internet or digital interactions with people. You interacted with people personally. You had to. And what kind of food did you have available? It was whatever could be grown. And that meant that there's sometimes of year you couldn't have certain foods, or that you might be hungry because there wasn't enough food. What changed in the past 100 years was suddenly there was this drive of, wartime came, and there was a drive to increase caloric intake. So, the driver then was, we need to grow and produce as much calories per person as we can. And that's true across North America and the world. So suddenly it became a driver of, make sure you get enough calories and energy or you're going to be undernourished, which at a period of time that was really true, but it went overboard. And then it came to a point where the food industry is able to produce far more calories per person in North America than we need. But that means that there's a bunch of extra calories. There's a bunch of extra things that are being grown, produced, livestock being raised. Where does that go? Industry sells it and they push it on us. Eat more, take more. And of course, our lives have become busier and busier, so we lose our social connections. We don't spend time with family and friends as much anymore. We have digital interactions. So our social connections have been lost. The type of diet that we eat has become processed, quick foods, high calories. The amount of sleep we get has been harmed by our
Yeah,
work schedule.
nutrient deficient.
Again, absolutely. So, and exercise. Who the heck has time to exercise? You're busy taking your car to get to work. You don't need to walk anymore.
Yeah.
Everybody's got a car. If you don't have a car, what's wrong with you? Right? In the old days, the only people who had cars were the ultra wealthy. Otherwise, you would walk to work like everybody else.
Or use
There
transit
was a far
systems.
So today, every part of society over the past 100 years has degenerated our diet, it's degenerated our social interactions, it's degenerated our exercise, our sleep. Sleep is being disrupted by lights and electromagnetic radiation in our homes from our devices. All of this put together, it's made us at a spot where we've forgotten how we're supposed to live. I mean, the way we used to live was how we had to survive. The past 100 years, it's become the way we live based on what's provided to us. We've become consumers.
Yeah,
And unfortunately, I think, Natasha, to your point, that's where we failed. That's where society is failing. And then when we get into that mindset of being a victim, right, that I'm a victim of my genetics, I'm a victim of what I'm being fed and everything around me, I have no control. So what am I? I'm now dependent on something outside myself. So then people look for a pill. Give me a pill, give me a supplement, give me an injection
Hmm.
that's going to fix me.
fast
Well,
fix.
okay, there are things that can help. Everyone wants a fast fix. It's because they look at the world as the outside world is responsible for me. What are you going to give me that's going to make me better or healthier? And the reality is that's completely the opposite. If you want to be healthy, you start with yourself. You need to look after yourself first. And I really believe very strongly any clinician that's involved in this space, they really need to walk the walk. You need to be a healthy person and be a role model, because we're the ones who are going to be helping other people to see what the right way to live is.
Yeah,
Yeah,
100%.
crazy.
100%. I was listening to a podcast recently that was basically saying that more and more people are isolated than ever before. I think in some way it has a little bit to do with the pandemic and digital interaction and all that, but the pandemic thrown in there really kind of accelerated that. I know for me, even it had an effect on me personally, my social interactions, because we weren't allowed to, especially I don't know if Ontario was the same, but in Quebec, it was pretty
Yeah,
strict.
yeah.
You know, we had like
Yep, absolutely.
curfews, and you know, some people like they just really, and I think a lot of probably a lot of more elderly people, and that's also dangerous. I think the more solitude you are when as you get older, the less social you are.
Yep.
Is it plays a big role
So
in
true, so
loneliness.
true. I think there is a loneliness epidemic. There's a loneliness pandemic. I mean, the entire world is suffering from
Yeah,
loneliness. And I
yeah.
agree completely. The COVID epidemic was a huge contributing factor, but we were already on that path. The
Yeah,
epidemic
we
just
were
kind of
just
pushed us a little bit
accelerated
further
it.
faster. But I mentioned earlier Dean Ornish, the lifestyle researcher and physician. One of the things that he speaks about is that people who are lonely, they have a 3 to 10 times higher likelihood of cardiovascular disease and heart attack. So loneliness is a high risk factor for heart disease and heart attack. People who go into a nursing home, their lifespan is shortened by 6 years. So, two equivalent people with the same age, same gender, same health status, put one in a nursing home, they die 6 years earlier. That's loneliness. In Singapore, talking about blue zones that we mentioned earlier, one of the things that they do in Singapore, which I think is amazing, they give families a stipend. First off, families there, almost everybody owns. There are very few renters in Singapore. The government subsidizes them so that they can buy housing. And then they provide a further subsidy for families that live within 1 kilometer of each other. So if you live within a kilometer of your parents, you and your parents both get a financial benefit from the government. What does that mean? It means people live close to their kids. They live close to their grandparents. You got a built-in babysitter. Parents are off to work. Grandparents get to spend time with the kids. Grandparents are still part of the family. What
Keeps
happened to the family structure that we used to have?
mm,
The model that we have now, go to work, the nanny takes care of the kids, or they go to daycare, and grandparents are put in a nursing home because they you don't want to have to look after them, or they're not well, it's risky. Not It's the exact
yeah,
opposite of what we should be doing.
yeah, and it
Yeah,
also
I
taxes
totally agree.
I think it taxes the medical system also, and which is already very quite fragile. I find, it probably puts a lot of weight on it too.
So
Uh,
true. Well, and to that point, right now our healthcare system is in crisis. And when I say
yeah,
our healthcare system, I don't just mean in Canada. I mean North
yeah,
America. I mean the world. The entire world is facing a state where our population is aging, and it's happening everywhere. It's not just here. And what that means is, and people are living longer as well. And what that
yeah,
means is that there's more people who are in that over 65 category. And you would say, oh my goodness, what's going to happen to our healthcare system? It's already in crisis. All these people need healthcare. But the thing is we have automatically assumed that aging means disease and infirmity and frailty. That's not the case at all.
it's
Aging
a
can be
mindset.
very graceful. People can be vital throughout their lifetime,
Yeah.
but you need to make the effort while you can. You need to exercise while you're able and maintain that. You can't wait till you're 75 or 80 and say, oh my goodness, I'm getting old. I better start exercising. The day to make a change to your life to live a long, healthy, vital lifetime, that day is today. You got to
Yeah,
start exercising now. And if you're not doing it now, then when are you going to do it?
I know.
Mm.
I agree with you 100%. I agree with you 100% because I feel like for myself, that's what I did this year. As I really have always been somebody who exercises and takes care of my life myself, and but even more now that I'm like, this is within my control. I am not going to
True.
be a victim of my age or like of, I just am going to be like, I'm in a thrive zone more than I've ever been in my life. And I wish that on people that they could look at themselves with, different pair of glasses and realize that so much is within their control. Not everybody, but like a large majority. And it's how you think about yourself, and self-care and self-love, and, you know, just doing the things that we
Yep.
talked about, more and more. So I agree with you. I think it's wonderful. I think it's a really good message for people to understand that they don't have to be victims of life. They can really take charge of it. And, step by step, you can't do everything all at once, but like step by step, you can make progress, and it makes a
The
big
journey of a
difference.
thousand miles, that journey of a thousand miles starts with a single step, right? And those
Exactly.
small steps get you to where you're going. One of my most favorite quotes is RuPaul. And RuPaul
Mhm.
at the end of every RuPaul drag race says the same thing. If you can't love yourself, how in the hell are you going to love someone else? It all
Yeah.
starts with self-love, and that self-love results in taking care of yourself, and those lifestyle changes that individuals make, and then families make, and then communities make, that's a public health initiative. That change in mentality and improved lifestyle will change the costs of healthcare. It helps to prevent heart disease. It helps to prevent cancer. We're so used to dealing with things after they break in a sick
Mm.
care model where something goes wrong. The expense and cost of managing things is so astronomical. No wonder our healthcare system is at its very brink of disaster. I
Hmm.
mean, I think it's gone past that brink, to be honest. The
Hmm.
only way to make things better is not to put more funding into healthcare system and pay more for a system that waits for things to be broken. I mean, the mentality of physicians and medicine up until now has been very much if something is broken, try to fix it. But it's because we didn't have the means to find people who are at risk or look for those things before they happen. That technology and knowledge didn't exist, and it does now. So, now it's about taking care of things before it becomes a problem. It's
Hmm.
not managing a problem, it's managing risk of a problem. And
Hmm.
managing risk is way cheaper and way easier. And our healthcare system, the benefit is ultimately going to be a huge reduction in costs of care.
Hmm. And
Yeah,
I think at this
I
point,
totally we say that all the time.
yeah, and I think it's up to the people to take charge of themselves, in that, instead of looking for the system to take charge of them.
Yep. In Canada, it's a very funny narrative. We have so much effort discussing public versus private healthcare, and there's advocates on both sides. And honestly, our public healthcare system, I think, is completely broken. And I'm not in favor of a private or a public healthcare system. I'm in favor of a healthcare system that actually delivers health. And so what I like to think of is an individual healthcare system. This is where individuals take care of their own health. Your objective right now, as much as possible, should be to maintain your health through your lifetime and try and use the healthcare system as little as possible.
Hmm.
And that'll be a benefit to everybody, but most certainly for you, because you don't want to have to go through our healthcare system right now. It's really not in a good state.
No, I agree. I
Yeah,
agree.
crazy.
So take
Totally
charge.
crazy.
Yeah. Well, that was
Yeah,
a
I
great.
love that.
Me too. I really do love that. Let's get into like a little bit more around
Rejuvenation.
rejuvenation
I want to
and
talk. Yeah,
yeah, yeah.
I think
For
that's
sure.
a
So
big topic as well. And like obviously you're the professional and all of that stuff. So, you did mention something before, senescence. Am I pronouncing this right?
yeah,
What
senescence.
is that? Senescence. Okay.
Okay, so senescence. Normally people think of senescence in terms of a human individual. If someone is a senescent, it means they're older or aged or cognitively
Oh.
impaired. So that's not what we're talking about here. Senescence in this sense is we're talking about a cellular function. So senescent cells are really interesting cells. So cells, of course, as we all know, those are the building blocks of our body, and we're composed of all these cells that work together. If a cell becomes really damaged and harmed, it can become a cancer cell. And that cancer cell is a cell that grows out of control. It can spread to other parts of the body. So that's very dangerous. So you have these normal
Hmm.
cells and you have these cancer cells. These senescent cells are somewhere in the middle. So a senescent cell is a cell that is no longer dividing. So normal cells, they divide, they split. That's the way they reproduce. Senescent cells don't split. They don't divide. They don't make new cells. They just stay as they are, and they keep living indefinitely. So while they're living, though, they secrete a whole bunch of really harmful stuff. And these harmful substances harm cells around them and also get into our bloodstream and go elsewhere. I'll talk about that in a second. But the harm that it causes to cells around them, it converts some of them over to becoming senescent cells. So basically, this cell, it's almost like it's infectious. It's contaminating other cells by secreting these substances, and making other cells secrete these substances. So one of the terms that's been used for these things is zombie cells. So the
Mm-hmm.
zombie cell is a senescent cell, and it's called a zombie cell because it's kind of behaving the way you think a zombie would, right? A zombie is it's a human, but it's not really healthy.
Yeah.
And if
Hmm.
it bites you or touches you, you become a zombie too. So you don't want to be touched by a zombie. So these zombie senescent cells, that's what they're doing. They're harming all the cells around them. And these substances that they're secreting then harm more cells all around them. And as I said, it gets into your bloodstream. So it's not just harming cells around themselves, it's harming cells in other organs and other parts of your body. So there are senescent cells in every organ system, your liver, your brain, your kidneys. Your skin happens to be a place you get a lot of them. And part of the reason for that is because skin is exposed to the environment, it's exposed to sun and air, oxygen around us. There's lots of things that are harmful to our skin. So our skin actually gets senescent cells. 1 hour of exposure to the sun actually increases the number of senescent cells in your skin measurably. And once they're there, they don't go away unless your immune system finds them and destroys them, which is hard. They don't always do that. So as you collect more of these, your body's having to fight more and more to get rid of them, but they'll miss some and more will collect. So time and sun both are very high drivers of getting these senescent cells in your skin. But again, the really important feature of these things is that they are secreting substances into your body, into your bloodstream that harm other organs. So following through from start to finish, you're out in the sun, you're not wearing your sunscreen, you're just like, whatever, I'm going to get a little bit of a base tan, it's going to be great. That 1 hour that you spent in the sun increases these zombie cells in your skin. These zombie cells are secreting substances into your bloodstream, and they go into your bloodstream and go to your heart and your brain, and they cause senescent cells to form there, and they cause cells to become inflamed and malfunction there. So that hour in the sun actually is trickling down to causing harm to every organ system in your body. It's aging you physically from the inside. So sun exposure is aging you, your whole body, not just your skin. So putting all that together, these senescent cells, this concept, your skin and your whole body health are directly related to one another. And a lot of people don't really think about that. They just think about, aging of the skin. I don't want to get old. I don't want to have wrinkles. I don't want to have blotchiness of my skin. So, people think of it in terms of aging and appearance, but the actual appearance of your skin, that aged appearance, is in fact a marker of the aging of the rest of you. And not only is it telling you, it's like a window into your body. It's like you see the aging of the skin. The same thing is happening to the inside. It's not just letting you see, actually it's causing aging of your inside. So how your skin appears and keeping it healthy is actually a really important determinant in your overall health and your health span.
I have been using the SkinCeuticals PTOX for a couple of weeks now, and I have to say I'm obsessed. This product is a needle-free anti-wrinkle peptide serum that visibly reduces 9 types of expression lines and reveals glass skin radiance. It's a great product to start using when you're not quite ready for injections, or like me, it's the perfect complementary product to use in conjunction with my Botox sessions to maximize wrinkle correction. I even have a couple of friends who have been using the product and have noticed change in their skin texture and any deep wrinkles they may have. You have to try it. Trust me on this. If you want to try the product, go to bskinenvie.ca. That's BSKINENVIE.ca and use code SkinTalks to get 10% off your next order.
Yeah, so it's really remarkable to think that even just 1 hour in the sun increases these senescent cells, and that results in aging of your whole body. So put on some sunscreen, stay out of the sun. It's actually making you older.
Yeah, from the inside out, not just from the outside in.
Yes, exactly.
Yeah. I did a little bit of research before getting onto this podcast, obviously, to understand a little bit more about like senescent cells. And it says that it builds up in the tissue also, right? So they like kind of get stuck. You said zombie
Yeah,
before?
exactly. Yeah, the it's a good word to use. Stuck.
Yeah.
These cells are stuck in a cycle where they're not replicating anymore. Cells are constantly turning over, and
Yeah.
these ones are frozen. It's like they're frozen in time and
But
just
they're still
secreting all
alive.
this. They're still alive, but they're secreting all this nasty inflammatory stuff. And our body is pretty good at finding them. Um, our immune system locates these cells and kills them. Now, some senescent cells, there is some benefit to having a low level of these things. There's actually a purpose to them. But like so many things, there's a purpose to a low level. as it increases, it starts to harm. And that's, in every organ system, you're getting these cells, and they're really harming your body. And going back to skin and whole body, it's not just these senescent cells. There are other ways that your skin and your health are directly related to each other. And another really important one is the microbiome. It's the
Yes.
bacteria, both on your skin and in your intestine.
Mm-hmm.
So there is actually a relationship between bacteria in your intestine and your skin. And it has been shown that certain types of bacteria or mixes of bacteria in your intestine can actually cause disorders of the skin, inflammatory things like
Mm-hmm.
psoriasis.
Yes.
It can actually contribute to eczema. It can cause cancer. So your intestinal bacteria is related to cancer of the skin.
Oh, wow.
And it's not just your skin. The intestine and the bacteria, they are actually related to your brain. So it's been related to depression. It's been related to epilepsy, seizures.
Mm.
There are a whole bunch of things where your intestinal bacteria are actually causing changes to your skin and your brain. And your brain and your skin actually also affect your intestine. So the GI tract and the bacteria there, and your skin and the bacteria there, and your brain. These three things, the skin, gut, brain axis, these three things relate to each other.
Mm-hmm.
So, you wouldn't necessarily think it, but the food that you eat and having a healthy set of bacteria in your intestine actually is a huge contributing factor to your emotional status and your mental state, and also to the health and the appearance of your skin. Um, Eating bad food actually does legitimately cause inflammation and issues in the skin. And so putting all this together, again, this is just another way that your skin and the rest of your body are related to each other in health. If your skin microbiome is off, or you don't take good care of your skin, your intestines suffer consequences. And likewise, if your intestinal bacteria are out of balance, it will cause consequences in your skin.
Mm.
So it is no longer okay to just think about your skin as some separate thing. I mean, people don't even think of their skin as being an organ. They just think about it as like a
I
covering.
know. Yeah, and we
It's
kind of take advantage of it our whole lives because when you're young, you kind of just you don't have any wrinkles yet, you don't have anything, like you don't notice any change. All of a sudden, late 20s, 30s, you start to notice, like, and then you get some pigment, and then it's like, oh my God, what's going on? But it's been going on all along,
Yeah.
right?
Yeah,
And
exactly.
it just
These things
shows
don't
up.
just develop. It's like, people who have a heart attack, it's like a surprise to them. And they come to hospital in pain, and, get a catheter, a stent.
Yeah.
And it's like, how did this happen? It was out of the blue. I have no idea. Well, no, you didn't know, but it's because you weren't tracking, you weren't aware of these things. But heart attacks don't happen overnight. That's like
Yeah.
not just 10 years, it's like 20 years or more of accumulation to reach that point. And Beata, exactly as you said with skin, people wake up one morning, they look in the mirror, and they say, wow, oh my gosh, how did I get older? This is out of the blue. I had no idea. Well, no, from the moment
Mhm.
you're born, your skin is aging, and you have
Yeah.
the opportunity to protect it and take care of it. And if you do that, you'll age gracefully. And if you don't do it, and if you abuse it, again, through poor diet, poor lifestyle, all of that stuff affects your skin. You will wake up one morning and you will see that, and
Yeah.
it's very preventable, and there are lots of things that can be done to help that.
Yeah. And the good news is it's all within your control, or
Yep,
most of it is
93%.
within your control.
Yeah, most of it.
93%.
Most of
Exactly.
it. Of course, there's exceptions to that, but the good news is that, like you said, today is the first day that you can start. If you haven't, you start and you take baby steps and you work towards it. And if you are, you know, younger, then you know what you need to do. You know what I
Yep.
mean?
It's
Because
when
this,
if you're younger,
yeah,
you have more opportunity to make changes. You have
exactly.
more opportunity.
Yeah.
It's funny, over the decades. I was asked, not that long ago, someone asked me about changes in generations as far as consumption of cosmetic treatments. What have you seen in Gen Z, Gen X, and the baby boomers?
Mhm.
What's changing? And the thing that hit me really is that each generation we have successively gotten younger in the people that we're treating. And when I say treating, I'm talking about the injectables. I'm talking about the
Yeah.
neurotoxins. I'm talking about fillers. You know that I don't like that. The fact that we're treating people at a younger and younger age on the premise that we're getting to you in a preventive fashion. Most
Hmm.
of these treatments are there is some amount of prevention, but they're kind of preventing the symptoms. They're not really addressing the
No root.
underlying issues. So, I like the idea of taking care of people younger and younger, because that's the time to start. The time to start is when you're in your teens and your 20s. That's the time when you should maximize your health, because the healthier you are, the longer you're going to coast for. You get to a point that it's harder and harder to maintain that. Starting at a young age allows you a better level to start from, and that will keep you going for a lifetime. So I do believe that we should be treating people younger and younger, just not with needles. We
Yeah,
should be
or
treating them with lifestyle.
if you are doing that, because there's the demand, obviously, make sure you're doing all the other stuff too, like exercising, community, eating well, sleeping well, managing
Skincare.
stress, taking care of your skin, doing facials, like all of that stuff. It's going to go hand in hand. You can't just do one without the other. I mean, you can, but it when you get older, it's not
You
going to
know,
change anything
the
necessarily.
here's a comparison. Let's say that you're in a boat, and there's a hole in the boat, and the boat is sinking. Now you
Yeah.
have a choice. You have a bailing bucket, and you
Hmm.
can start bailing water out of your boat. Now you can keep bailing, and if you're fast enough and you bail well enough, the boat's not going to sink. But what if you just plug the hole?
Yeah, exactly.
Stop the water from coming in. Wow, that's what we're talking about here. You can get Botox and fillers and lasers, and there's a role for those things. Don't get me wrong. Look, I'm a plastic surgeon. I believe that there's a role for surgery. There's a role for treatments and therapeutics, but that role is like bailing water out of the boat. Yes, if you plug the hole, there's still water in the boat, and no matter how good you are at plugging that hole, there's still going to be some water coming in. There is a role to use treatments to take care of that. And bailing
Hmm.
the boat out is not a bad thing to do. But you got to plug the hole first, because as long
Yeah.
as that hole is leaking, you're never going to be able to bail
Yeah.
enough. And in the end, while you're bailing, you're going to be causing harm. Each of these treatments has risks and disadvantages. And the more you do, the more risk there is to patients. And in my opinion, the goal here is minimalism. We need to maximize lifestyle and minimize the therapeutics that we're delivering to patients.
Mm, I like that. I wanted to
I
add, sorry, go ahead, Tash.
I are you because I have a question which I'm taking like a total turn onto something
Yeah.
else. So unless you wanted to ask something related to the
No, I wanted to get into oxidative stress, and maybe that's also the same thing, like the effects on the body.
no,
What
I
did you
just
want to?
I had a thought which is like not even a part of this our topic here, or maybe it is, I don't know, but I was listening to this episode recently about C15. Have you heard about C15, this fatty acid?
Nope, hit me. Tell me about it.
Oh, I wish I could. Like to the extent that you're talking, like it's basically, I was listening to this episode and there's this woman that was studying dolphins, and
Yes,
for
it's
the
getting
Marines, and yeah, in America, and
hmm.
basically this C15 was ultimately a fatty acid that's better than omega-3. They did tests, and it really helps like prolong your life and is good. Like I'm definitely not going to describe it the way that the the researcher was on the Skinny Confidential, but I would love to have a conversation with you once you like do the research on this specific thing, because I'm actually taking supplements for it. I tried the supplements because apparently it makes you live longer and you have like nicer skin, nicer hair, all these things, and there's so much more research around it, but it comes from dolphins because dolphins have this like beautiful skin and
Dude, they're
all
like
this.
snatched their whole life.
Yeah, they look amazing.
I love
And
that.
so
Dolphins look snatched. So I can't say I'm any expert. I've just had a quick look up. So it's an odd chain saturated fatty acid. So it's a type of fat with an acid chain on the side of it, and it's been shown to activate pathways that are associated with longevity, AMPK and mTOR. Which are two really huge components. So it's a stimulant of the pathways that are related to some of our cellular repair and epigenetic repair mechanisms. So it does seem to be an interesting candidate.
yes.
One of the things that I got out of my visit with the Buck Institute, and just in general, there is there's a plethora. I mean, there's a wide range of peptides, proteins, fatty acids, and other synthetic substances, and repurposed medications, stuff that we've been using for decades, generations, that have been repurposed that have impact in this area. So there is no one right answer to all of it.
Mm.
There's no peptide that's going to cure you any more than there's a drug or pharmaceutical that's going to cure you of everything. But all of these things have a role, and the key of this is going to be to sort of figure out what role they each play, and how to put them together into an optimal treatment. One of the things that was raised, there's a clinician researcher by the name of Brian Kennedy. I spoke to Brian and met him in Singapore in the spring this year. And one of the things that he talked about was sort of polypharmacy, or the sort of overuse of these kinds of supplements. And not to say there's anything wrong with C15. I mean, from my quick read, it looks like it's something that's very promising. But the interconnectedness of everything in the systems of our body makes it such that any one of these implementations actually affects everything.
Okay.
And if you combine them, they're not necessarily synergistic in a positive way. Sometimes one will block the other and negate its effect. Sometimes they both will block each other and you will lose the effect. And sometimes two things together actually can cause a negative, harmful effect. And we don't know what these things are yet. Until
Yeah.
we have a fully outlined digital human model where we can look at this.
Yeah.
And that digital human will be an N of one. That will be for each person individually based on our genetics. A digital model or twin of us can then be tested and say, if you take these three things together, that's your optimum combination. Or if you take these two things, actually, it's going to harm you. So, the take-home message, I guess, about not specifically C15, but just as sort of the collection of all of these supplements together, is be cautious.
Yeah.
Don't take too many. I would say, limit to 2 or 3 at a maximum, because you don't know. Nobody knows how these things stack and combine.
There's no studies on it yet. Like, we don't have enough data.
Well,
right?
And honestly, it will be impossible, because the number of different things, to
it's
test
too much.
C15 and how it relates to rapamycin or metformin or any of the peptides that are really popular right now, how it would be an infinite number of studies to look at all of these combinations. So until we have a digital twin that you can do this testing in a virtual setting, which it's coming, but it's not here yet. Until then, you don't know. There's no way, and it can never be studied, all these different things, because every day there's new things coming out that are proposed as longevity tools. We need to be able to do those digital tests to know how to combine them and how to avoid harm. Because absolutely there is the potential to harm yourself if you take too many of these things, and they will interact in ways that you can't predict.
Yeah, I definitely will be sending you more information. I'm going to send you more information on this after, but I definitely agree that taking too much and like overindulging and like all these different things, it actually stresses me out so much. Like I've never been one to consistently take supplements because I have no knowledge of like what I really need. And a lot of the stuff I don't actually really 100% trust what's in it. So I definitely agree with you on like the overconsumption of all this stuff. And sometimes I think to myself, like, what am I even doing? What am I even putting in my body? But after I listened to this episode, I was like, you know what? I'm really going to try this. I did some research on it. I forgot to mention that C15 is a huge component in milk. And the reason why also is that in the episode, they spoke about how those who live in blue zones have a much higher C15 than those like who don't live in blue zones, or who those who are not consuming as much, let's say, dairy products or milk specifically, because it's super high in that. Anyways, I'm trying it. I'm going to let you know if I feel any different, or probably not. I think they say like between 6 to 9 months is really if you see a difference or you feel more energized or these things. But after this episode, I'm going to send you the details, and then you can kind of give me a thumbs up or a thumbs
That's
down.
what you think. But I think the message around be cautious is the important message,
100%.
because there's so much out there, and everybody seems to be looking for the miracle on like, I have a problem, I need to, like, it needs to go away, or I'm here now, instead of this, again, going back to lifestyle and what's within our control. And
Yeah.
I think
Well, there's a good segue there, because one of the things that people talk about a lot right now is NAD and NAD levels.
Mhm.
Yes.
And so
I want to go into
there's,
that too.
tons of discussion about falling NAD and supplements that you can take to make sure you keep up your NAD. So let's talk about that, because
Okay, let's get into that. That's
NAD,
Top off.
those kinds of supplements, that's one of those things where you're modifying something and you don't necessarily know all the consequences, and also you may not be treating the right thing. So first off, let's talk about what NAD is, and
Mhm.
and also what happens to it in our body over time. So what it is. So NAD is sort of an intermediary. It's kind of in the chain of events that our body, our cells use to create energy. So, we eat food, and that food, the nutrition energy, is then converted into chemical energy that our cells can use. That chemical energy, that unit is ATP. ATP is sort of the currency. It's, your cell produces this and you use it to do stuff, growing, making new molecules. ATP is the energy that makes that happen. So ultimately, as a human, we eat stuff, and that food stuff gets converted into ATP. And there's a bunch of steps in the middle, but this NAD is one really, really important step. And NAD is sort of a shuttle. It shuttles some electrons. And electrons are really important because that's kind of like electricity, right? Electricity is flow of electrons. NAD is one of the intermediaries or steps along the way in our production of energy, and it actually is shuttling electrons through this process. So, what people have found is that with aging, both in men and in women, there is a declining level of NAD in every organ. Now, interestingly, that varies organ to organ, and roughly speaking, it's 20 or 30% in most organs, like the liver or the heart. The organ that has the highest level of NAD decline is, guess, it's skin, right? It's the skin, and that's about 50 to 60% reduction in NAD over a lifetime. So that's a big difference, right? And so there's this, and I have my thoughts about that, but I'm going to get to why I think it's most in the skin. Um, the thing about it is that people recognize that there's been a dropping level of NAD, and so there's this belief that if your NAD levels are going down and you're aging, that therefore the dropping NAD levels are causing the aging. And it's important to remember that correlation and causation are not the same thing. Just because NAD levels are going down as you're getting older, it doesn't mean that your dropping NAD levels are causing you to get older. It just means that they're happening at the same time. So people are taking NMN and NR, which are very common supplements that you can take, and these two substances are sort of precursors to NAD. So when you take that in, it helps, it increases your NAD levels because you're sort of pushing more, creating more of this NAD. Here are my thoughts on the story. It's I think it's an area where people are missing the boat a little bit, because the issue in our body is not really that the NAD is declining. It's just that it's being converted to a different form. And the different form that's being converted to is NADH. And the only difference between the two is that the NADH is a reduced form of NAD. And what that means is it's gained an extra electron. And so when it gets reduced and it becomes NADH, it would normally sort of pass along the chain of becoming energy in the cell. But this comes back to oxidative stress, which we've talked about before in our earlier podcasts together. Oxidative stress is one of these stressors that builds up in all of our tissue and in our cells, and it's these charged oxygen particles, these oxygen free radicals. These things are actually backing up this whole NAD NADH transition. And so in our life, what happens is actually not a reduction in NAD, but actually a shift of NAD to this reduced form NADH. And why is this important? Well, it's not so much that we've lost overall in the pool of NAD. It's just that it's being converted because of oxidative stress into this other form. Once it's in that other form, this backs up our energy production. It prevents our cells from producing energy. It actually steals energy in reverse. It reverses the flow, and uses energy while it's busy trying to manage this oxidative stress. It's trying to reduce these oxygen-free radicals. And so that's a big deal. So, I mean, people are taking NAD supplements, but in my opinion, the bigger issue is that there is a shift of NAD to NADH. And NADH is actually very difficult to measure in the skin or in any organ. So people are really focused on the dropping level of NAD and taking supplements. But in my opinion, I think that a big part of the issue is not just the dropping levels, but rather the shift, and it's related to oxidative stress. It's related to the stress that our body is under. And so really, it's an oxidative stress issue, not so much a declining level of NAD issue. I hope I made that clear. I know
Interesting.
it's a
Yeah.
it's a, it's a
Yeah.
Yeah.
complex concept, but that shift rather than a drop in overall level because of oxidative stress, I think is really the kind of thing I'm trying to drive home. So does that make
So,
sense to you guys?
Tackling
yeah.
oxidative. So that was one of my questions before. Let's talk about like what is oxidative stress and how can you manage it or like handle it or prevent it as
Yeah,
much as
very good
possible.
question. So oxidative stress is this constant state that we're in of these oxygen molecules causing harm to our body. So, we generally think of oxygen being a good molecule, right? We have oxygen in the air around us. We need it. We breathe it.
Mm-hmm.
It's a precursor. It's part of our energy production. If you don't have oxygen, you can't survive.
Yeah.
So it's unbelievably important to us. However, it comes at a consequence. Oxygen is a really toxic molecule. And the reason it becomes toxic is when it has a charge. If it gains an extra electron, it goes from being an oxygen molecule to being what's called a reactive oxygen species, or oxygen free radical. And this is basically an oxygen that has an extra electron on it. And that electron is harmful. It's oxidative stress. It's busy trying to harm all the cells and the structures around it, DNA, proteins. So this oxidative stress happens both inside and from the outside. The outside, sun exposure causes oxidative stress, pollution, lots of other things.
Like
But
just
actually,
stress
that's only about
itself.
stress itself, sure. From the inside,
Yeah.
absolutely. Physical, emotional stress
Mm-hmm.
causes oxidative stress as well.
Mm-hmm.
And that internal form of oxidative stress is actually 90%. That's the vast majority of our oxidative stress. And this is just from normal energy production in our cells. Our mitochondria are like power plants, and they're busy trying to create energy. There's pollution, there's byproducts, and oxidative stress is the primary one that it's producing. And so our cells have mechanisms to try and take care of this and mop it up. They're constantly cleaning up. Our mitochondria, our cells are making energy. These oxygen-free radicals are being produced. We mop it up and get rid of them. And the way we mop it up and get rid of them is with this enzyme that we evolved over 2.5 billion years ago. And that happened when oxygen first started to appear in our atmosphere, and cells and the ancient life forms that were around at the time, they evolved and gained this specific enzyme that's able to help mop that up. And that's what allowed us to continue evolving. At the time, actually, all life on the planet almost went extinct 2.5 billion years ago. It was called the Great Oxidation Event, and really almost ended life on the planet. And there's a specific enzyme called superoxide dismutase, SOD,
Mm-hmm.
Oh, yeah.
that actually is the thing that we evolved at that time 2.5 billion years ago. That's the thing that saved us. That was a savior. And we still have it today. Every organism on the planet, almost every single organism, produces this stuff, and we require it to live. And this comes back to one of the previous episodes that we discussed, the oral supplementation of superoxide dismutase, like glycodin. I'm still a huge supporter, and I think that it is something that reduces oxidative stress. And there's been study after study. I mean, there's more than 40 human studies on this now over 20 years. And I think that it's going to play into the discussion about NAD levels, because the oxidative stress that is driving the NAD to shift over to NADH, I think that we can manage that and reduce it using this oral SOD, this glycodin. And I think that that's going to be a significant contributing factor to managing NAD levels with age.
I am loving Jan Marini's Luminate Eye Gel. I've been using it for months, and it's my favorite product for tackling dark circles, puffiness, and crepiness. It's packed with retinol power, but gentle enough for everyone. And if you're dealing with milia, its gentle formula hydrates without being too rich. You apply it under eyes only and never on the lids. And remember, as with most retinols, there's an acclimation period. So start slowly, like 2 to 3 nights per week, and then gradually increase to every night. I promise you won't be disappointed. If you want to try this product, go to bskinenvie.ca. That's bskinenvie.ca, and use code SKINTALKS to get 10% off your first order. Okay. And so I just wanted to ask you, that's very interesting. I find that very interesting.
Yeah.
One thing is causing the other thing, and managing one thing will have an improvement on the other. But have you heard about like, I know there's the oral supplements for NAD, but what about like the NAD infusions?
Yeah. So I think that there is definitely a role for NAD infusions, oral NAD, and the oral NAD, that's the NMN and the NR. And there's huge debate about what's better, NMN or NR, and people on both sides. I take NMN. I recently saw some evidence that suggests that NR might be more effective. But to your question, taking any kind of supplementation to try and get your NAD levels up. I think it's reasonable. I think there's a role for it. IV NAD infusions are costly, and there's some discomfort associated with it.
Yeah,
It
I
feels
did
like
it
there's an
once.
elephant on
So
your
we have it
chest.
in our,
Yeah,
yeah, it kind of makes your stomach and like uneasy heart could
yeah,
feel like, because you kind of go, what's going on? But I think if you take it very slowly, like it needs to be, it's not like an
yeah.
energy or a vitamin C infusion.
I've
It's
heard of some people. I've heard of some people who have done it over half an hour, and I can't imagine. I mean, that
oh
must be
no,
really, really harsh. So I mean,
yeah,
ultimately, it needs to be done over a few hours so that you minimize those sort of
yeah,
sensations. And what's the role for it? I would hearken back to the boat analogy. That boat, as long as it's leaking, bailing water is not a solution by itself. So
yeah,
adding NAD to the pool, if you think of the NAD NADH thing as being a ball at the top of the hill versus at the bottom of the hill,
hmm,
your NAD is at the top of the hill, and when it gains that extra electron, it's rolling down. We have a bunch of balls at the bottom of the hill. The
hmm.
key that we want to do here is push them
Keep the
back up
ball.
to the top of the hill. The other strategy is put more balls at the top of the hill. I mean, you can keep putting them
Yeah,
there, and they're going to keep rolling down. But as long as you keep feeding that, you're going to have NAD levels that are elevated, right? Your balls are still at the top of the hill. So, again, my mind, I think that there's a dual strategy here. I think it's reasonable to supplement the NAD, whether it's through intravenous or oral forms. But I think that the elephant in the room, or the sleeper that really isn't being discussed very much, is why? Why are these
yeah,
NAD rolling down the hill? Why are they getting reduced? It's because of the oxidative stress that we live in consistently,
hmm,
and that oxidative stress increases with age, and it is related to every single inflammatory disorder in the entire body. And in my mind, it is one of the, if not the primary drivers of aging. It is integrative. It affects every other hallmark of aging, from telomere length to methylation, to dysbiosis to senescence. All of these mechanisms, all of them in one way or another, are related to oxidative stress. And the NAD, NADH, the balls at the top and the bottom of the hill, I think it's part of the same picture. And really, I think that we need to start managing our oxidative stress better. And there's no magic bullet for anything. But I think that SOD supplementation and this glycodin, molecule, I think is a game changer. I think it's a really important component of that. And to my knowledge, still on the planet, this is the only substance that can up your SOD, your superoxide dismutase, through oral supplementation. And there's a lot of data behind that. So
hmm.
actually, I'm going to be submitting this to the National Institute of Health next year for their intervention testing program, which I'm really hopeful to get accepted to that, because I'm excited to see what the results will be.
Mm.
But I think that fits into the NAD picture. So, I do fully support the use of NAD. I think at this point there's enough evidence to say that there's benefits to it. I think that picture and how we're going to do that is going to evolve and change with time.
Hmm.
I love it.
It is
So,
very interesting. So yeah, go ahead, Tash.
well, I want to know because this we've touched on so many topics in this episode, and like for a listener who is listening to this who like wants to improve their health or is curious about trying these different things and dabbled in supplements, like where do you tell them to start after listening to this sort of episode? Like they're getting a little bit older, or let's say like even me, I'm 30 now. I want to start really honing in on my health. Like, given the conversation we had, what would you recommend a listener?
For sure. So, I guess the first thing I would say, as we started out with the conversation, I
Yeah.
would recommend lifestyle. You
Hmm.
know, move more, eat less, and love more. Be connected with people. Do those things. That's number one. Number two, get some metrics, get some measurement. It's hard to know if a supplement or something that you're using is benefiting you if you can't track it. So get a set of blood work, get some imaging done, get some background information so that you can see how things would change, and know what's going to change, so that when you start taking a supplement, what are you looking for? What are you expecting to happen,
Hmm.
to know that it's doing something for you? And then the third thing would be then embark on those supplements and things that you would add in. Um, I put glycodin as a little bit of a separate entity, because in my mind, The oxidative stress that causes us harm is in everything. It's
Hmm.
ubiquitous. It's in all of our cells. It's caused from the inside and the outside. All of our organs are being harmed. Every disease process is in some way related to this. I personally see this as a core. I think of it as a daily vitamin. I recommend it to everybody. The only patients who I have any reserve about are celiac patients who have gluten true allergy, because this stuff does contain about 30 milligrams of gluten in a daily dose, which is less than the recommended dose for celiac patients, which is 50 milligrams. So it's less than that, but still that's the only population.
Yeah.
So it's a recommendation I make for everybody. So lifestyle, do some monitoring, see what your dashboard is, get the information, glycine. I see that as a sort of central for me and my patients.
Mm-hmm.
Beautiful. I love it. I think
Very.
that's really good. Yeah.
Yeah, no, it's very interesting. There's one more subject that I wanted to ask you about, and we didn't touch on it yet today, and I'm going to try and remember how to pronounce it. It's the phenol croton oil peel, right?
Yeah, phenol croton oil.
We spoke
I
about
love that
this one
stuff.
of our
Great,
previous
but
episodes.
I've seen a lot of your Instagram, your before and afters and stuff with this peel, and I wanted to talk about it and what it is and who you recommend it for. And
For sure. Well, I love doing these kinds of chemical peels. And to be clear for the listeners, the phenol croton oil peel, it's a chemical peel, which lots of people have heard of, but this is not a sort of med spa level peel or something that you do in an office setting.
No.
This is a peel where I bring patients to the operating room and I apply this stuff and do this treatment while patients are under an anesthetic and being monitored. And
so
it
they're
is something that,
completely under when you do it,
yeah,
like you would
yeah,
if you were operating.
exactly.
Wow.
And you can do small areas like under eyes or around the mouth or other things under local. So there are ways of doing that. But when it gets to be a broader treatment, it's safer and necessary that a patient is monitored and under at least intravenous sedation. And in my hands, my preference is general anesthesia. And this is a peel that's only done by plastic surgeons and some dermatologists, because it requires a physician to apply, manage, and do the follow-up care.
So it's a lot more intense, like than the CO2, for example, which is very trending right now. I see it everywhere.
Yeah.
Like it seems to be the thing.
Look, I know that there are people who have some good results with CO2 lasers. I have seen patients who have come to me after CO2 lasers and tell me how painful it was and that they were very disappointed in results and asking for appeal. So, every tool has its place,
Mm-hmm.
and I don't have a CO2 laser, so to be transparent, I can't say yes or no.
Mm-hmm.
But from what I've seen, I think that it has a place, but not in my practice. In my
Yeah.
practice, when people come to me with loose skin, wrinkled skin, sun damaged skin, pigmentary changes, those age related changes and photo changes, the sun related actinic damage changes, that speaks to me to a phenol croton oil peel. And the procedure takes me an hour or so in the operating room. It's about 7 to 10 days to heal the burn after that. So I mean, it's 7 to 10 days that there's I put a
Down to
topical on
oozing.
or a mask, and so it's the aftercare and getting over that requires some effort from the patient.
Mm-hmm.
And even after the first 7 to 10 days, when things have healed, the skin is red. I mean, really, really red, like fire engine red, and that lasts 2 or 3 months. And it tapers off to a lighter pink color,
Mm-hmm.
but it really takes a few months to get over that. But the outcome, the tightening of the skin, the smoothing of the skin, the pigmentary removal, all of it, I mean, it legitimately is reverting you to a younger age. It thickens the collagen measurably. It reduces damage in the skin. It's actually visible under a microscope. Biopsies have been done showing this. It hasn't been tested yet, but I believe that it reduces senescent cells in the skin. So, relating this to our longevity talk, I think the phenylcrotonol peel is one of the very few treatments that we do on skin that genuinely has an anti-aging component to it, where it's removing these senescent cells, and that reduces, burden on your entire body as well as your skin on the face and the area. So I really kind of see this as an anti-aging. It's not just about the appearance; it's actually reversing age of the skin and the rest
Can
of
you
you.
do it on different areas of the body? Like, could you do it on your décolleté, like your arms, your hands? Or is it just the face?
Face, you can do very light peeling on the neck,
Okay.
and the reason is quite simple. I mean, this is intense, and it requires special skin to heal. And outside of the face, and to a lesser extent the neck, the skin doesn't have the same concentration of glands and follicles to
Yeah.
allow it to heal that quickly. So ultimately, it really can only be done on the face and the neck. Other than that, it can't be used. You can't, people ask me, can you do hands or other? No, you can't. It won't heal, and it's not safe. So this is a face and neck kind of treatment, and that's it.
So what is
So B,
croton
when are you
oil?
going?
What is it? I want to, I know. I'm like ready to do, I do
These
things every day,
questions.
but I'm like, but I want to know, what is phenol croton oil? What is the source? Like, is it a plant? What is it? It
Yeah.
sounds very
So
natural.
the phenol is a chemical,
It's a
and
chemical.
it's yeah, it's a chemical. The
Say she
croton oil
sounds very
actually is
natural.
derived from a plant. So the croton oil is derived from a plant, and it had unusual origins in the Second World War. It being used as a cleaner and a substrate, and they didn't recognize the potential use of it, and it only became used in a cosmetic sense when there were estheticians. I know we're not meant to use this term, but this is how they were introduced to me. The gypsies
Okay.
in Florida, there was a person who was categorized as a gypsy. This was a person who was practicing aesthetics from their garage, and a plastic surgeon became aware of them because people were coming into his office and having amazing skin, and
Wow.
he couldn't explain it. And so this is how this entered modern medicine, and this is now going back 40, 50 years. From that, the ingredients got derived, figured out, and then it was scientifically tested as far as how to concentrate and mix them together, rather than just a dash of this and a drip of that. And now at this point, the formulation is standardized and consistent, and it's been that way for at least a generation. So the person who taught this to me, I learned it in 2010. I've been peeling for 14 years or 15 years now, and what he's taught me is sort of that standardized version. His mentor had kind of finalized that formulation. My mentor, Dr. Richard Ben Simon, is the person who I think really popularized this, and clinical care around it. And that's the protocols that I follow have been kind of created through those two generations before me. And I'm very grateful for that, because this is not something that you can just learn by trying it out. You really
Yeah, it's
a
very
lot of
cool.
experience and a lot of mentoring to be able to do
Yeah.
it.
Yeah, I would imagine, because you're putting it on the skin under, that you have to watch the reaction of the skin in certain areas of the face, and it must be, it's more complicated. It's not that obvious, but it sounds, I've seen on your Instagram before and afters from some of your patients, and I would imagine that, like, when somebody comes in for a consultation to do plastic surgery or other types of treatments, sometimes you may be able to avoid it by just doing this also in some cases, right?
Yeah, I agree with that. So, our goal ultimately is to try and keep people healthy and prevent the sun damage and the aging. But once they get to that point, oftentimes the peel is the best alternative rather than surgery.
Rather
Hmm.
Surgery,
than, yeah.
cutting out skin or lifting, pulling, there's a role for that. But I think that there's a role for the peel. And some patients I'll do both. And I'll do, a facelift first, followed by a peel, or peel then facelift. The treatment order and what's right for a patient is very individualized.
Individual, yeah.
Uh,
Have
yeah,
you done it
yeah,
yourself?
Very
absolutely.
cool.
No,
You've not done it?
I'm. I have not, and I don't feel like I'm at a point where I need that yet.
No,
So,
but I'm
this is
just
a pretty
curious.
intensive thing. It's the kind of thing that I would absolutely undergo when I get to that point in my life. But my goal, as I'm telling other people,
Yeah.
is take care of yourself today so that you can put off these things. And eventually I'll probably come to needing that, but I'm hoping to put that off by 20, 30 years, and at
Yeah.
that point
Love
then I'll be
it.
ready.
Okay, so Miss, yeah, I remember in our last episode that we spoke about it, there was like an age where you would, like, you don't do it when you're 40 or 50, you do it like later on in your life, no? Unless somebody has
Yeah,
like severe sun damage
you
prematurely.
you got it, Natasha. That's exactly correct. It's the question of the amount of sun damage, and
Okay.
in a few weeks, I'm going to be peeling someone who's in her 40s, and
Okay.
it's not typical, but she has very fair skin and has acquired a lot of sun damage and skin laxity because of it. And she
Okay.
comes in, she kind of said, "Oh, I want a mini facelift and I want my eyelids," and I'm like, "You don't need surgery. Your skin is just getting a little loose because of sun damage." So, the right age is really when someone has that
Yeah.
actinic
Mm.
damage. And generally speaking, that's more like 50s, 60s, but it can be earlier. It can be 40s,
Mhm.
depending on the patient.
What about when you have
Okay,
melasma?
amazing.
Is it something that somebody who has melasma on their skin, like more profound pigment discoloration issues, is it something that you can recommend for
Yeah,
that?
yeah, it does. It is a good treatment for that as well. Those patients need a really solid before and after
Hmm.
management
Hmm.
protocol,
Hmm.
because certainly people who have pigmentary disorders, if you peel them, there is a risk of causing additional pigmentary disorders.
Yeah.
So, addressing the underlying oxidative stress and preparing the skin is super important for those people. But yes, it can be used for those purposes.
Okay.
That's good to know. Noted.
Noted. Yeah. And can you do more than one in a lifetime? Like can you do one at 55 or 60 and then do it again at 80?
You can, absolutely. And it's not common that someone would get to that. Once you've kind of reset skin and someone takes care of it, it doesn't often get to that point. But yes, it can be done, absolutely.
Okay. Very interesting. Well, this was wonderful. I learned so much.
Thank you so much. Yeah. It's
My
amazing.
pleasure, guys. I really enjoyed the conversation as always. Looking forward to the next time we get the chance to chat.
I love it. And
Yes, us too.
I love your approach on how you see things. Like, I just think it's a very good message.
Thank you. I really appreciate that. Well, I'm hoping that collectively together, we can help reset the beauty industry to focus on true natural beauty, helping people to achieve that through the right methods and applying therapies and treatments, at the right time and the right person. Together, I think that we can help evolve our beauty system as much as we're evolving our healthcare system.
Absolutely.
100%. Yeah.
Yeah. Thank you so much
for
your time today.
It's my pleasure. Thank you so much, guys. Take care.
Thank you.
Thank you so much for listening. If you enjoyed the episode, please take a moment to rate, review, and follow us on social at Skin Talks Pod. We'll see you next week.